Welcome back to the Deep Dive. Today, we are going behind the scenes, behind the velvet rope of high-stakes scientific publication. We're looking at the ultimate gatekeepers of medical knowledge, the peer reviewers.
It's a role you really can't overstate. For journals like Radiology, which, publishes some of the most critical medical imaging research in the world, the peer review isn't just some formality. It is the core quality control.
So it's what determines what science is actually trustworthy enough to be shared.
Exactly. It's what separates the good ideas from the truly rigorous, impactful work.
And the stakes, they couldn't be higher. This is research that directly influences how doctors diagnose, how they treat, and ultimately patient outcomes all over the globe. So our mission today is to unpack this surprisingly rigorous and highly structured process for writing an outstanding peer review.
And that process, well, it lays out a really demanding role for the reviewer. They have 3 core responsibilities. First, evaluate the raw validity of the research. Does it sound? Second, guide the authors on how to improve their paper. And finally, help the editors make that ultimate call.
That sounds like a huge commitment. These are experts with busy clinical and academic lives. Why do they do it? What's the real incentive?
Well, the incentives are both professional and, practical. On the professional side, you get to be the absolute first person to read about a potentially groundbreaking discovery. That's powerful.
A sneak peek at the future.
A sneak peek, yeah. And beyond that, there's formal recognition. The best reviewers get acknowledged at the Editors' Recognition Awards, and many can get continuing medical education credit, CME credit, for their work.
And does the journal help them keep track of all that service?
Oh, absolutely. They can track their contributions on platforms like Web of Science. It's all integrated, so it's a clear part of their academic record.
Okay, so let's get into the process itself. A reviewer gets a dense new manuscript. Our sources say they have to follow a mandatory structured reading approach. Why so rigid? What's the danger of just skimming?
The danger is missing the forest for the trees. Or, on the flip side, getting wowed by a big headline result and missing a fatal flaw in the methods. That's why the journal insists on this 2-pass system.
2 passes, okay.
The first read is all about humility. You just read the whole thing, abstract, intro, methods, everything, just to understand what the authors are trying to do. You're getting the big picture.
So pass 1 is about understanding the intent. Then pass 2 is where you test the argument itself.
Exactly. The second pass is the real deep dive. That's when you pull out the scalpel. You're evaluating every section, every table, every figure, looking for those specific technical issues. And what's really interesting is that a lot of top reviewers will actually pause between reads to check the literature on PubMed just to be sure they're completely up to date before they judge the paper's novelty.
That makes so much sense. Understand the argument before you challenge it. But then how do you translate all those notes and critiques into something an author can actually use?
Yeah.
This seems like a huge communication challenge.
It is, and the guidance treats the review less like an essay and more like structured business communication. You have to separate your comments into 2 completely different channels. One for the authors and a confidential one just for the editor.
Okay, let's talk about that confidential channel first, the one for the editor. Why can't you just leave that blank or copy-paste your author comments?
Because the editor needs the pure, unvarnished truth. No diplomacy. This is where the reviewer says, accept, reject, or revise, and gives the evidence to back it up. The focus has to be on the big picture stuff. The study's novelty, its impact, its rigor, what makes or breaks the paper. And critically, this is where you have to report any major ethical red flags.
Like plagiarism or?
Plagiarism, duplicate publication, any concerns about how patients or animals were treated, it has to go there.
So the editor gets the bottom line. The risks, the rewards. Now, what about the feedback for the authors? What's the format for that?
That is all about structure. The editors want a standardized format because it makes it so much easier for the authors to respond point by point. No ambiguity.
Okay, so what does that structure look like?
It starts with a research summary and overall impression. Just a short paragraph, maybe 2 to 5 sentences, covering the study's aim, approach, findings, and how it fits into the bigger picture.
I love that. It forces the reviewer to prove they actually understood the paper before they start critiquing it.
Precisely. After that, you list 2 to 4 major strengths and then 2 to 4 major weaknesses. It's important to start with the strengths, to be constructive.
Right.
And then comes the detailed part. Numbered lists of major and minor comments. Major comments are the deal breakers, things that absolutely must be fixed. Minor comments are more like suggestions for improvement that won't change the main conclusions.
And the number one rule for making those comments helpful?
Oh, specificity. You have to cite the page and line number from the PDF for every single comment. If an author has to hunt for what you're talking about, you've failed as a reviewer.
Which really brings us to the whole tone and ethics of feedback.
Mm.
The guidance talks about a golden rule of review. Write the kind of review you'd want to get. But this isn't just about being polite, is it?
Not at all. There's hard data behind this. The guiding stresses being respectful, realistic, and fair, because overly harsh reviews, ones that attack the scientist instead of the science, can disproportionately harm researchers from underrepresented groups in STEM.
So the reviewer's job is also to be a steward of the scientific community, to build it up, not tear it down.
Absolutely. And the sources give a great example of this. They contrast a useless, vague comment with a really constructive one.
Okay.
So the bad example is just writing. The author's conclusions are incorrect. That gives the author nothing. It's just a dead end.
Right. The good constructive example.
The effective example cites the exact spot, page 9, line 15, and then explains why the conclusion is a problem. For instance, they might say the conclusion is too strong because the study was tiny, just 25 patients at one hospital.
So they provide context.
Yes. And then they recommend a fix, something like, please temper your language to reflect that these results are preliminary. Or they might say, you need to remove the conclusion about modality C entirely because your study wasn't designed to test that.
That is just, it's so much more professional.
Hmm.
It's all about the content, not the person, and it gives them a clear path forward.
And that focuses everything. Reviewers are told explicitly, do not waste your time on things outside your expertise. Don't comment on grammar or typos, or if the authors follow the radiology style guide.
Leave that for the copy editors.
Exactly. The reviewer's job is to focus purely on the substance, and they assess that substance across 6 key pillars. This is the heart of the review.
Okay, let's break them down. Pillar 1 is novelty.
Right. How new is this, really? Now, a little bit of novelty, what they call incremental novelty, is fine. Optimizing a technique, using a bigger sample size, that's valuable. But what reviewers have to watch out for is an ethical issue called unnecessary segmentation.
Unnecessary segmentation. What's that?
It's when a researcher does one big study, but then to get more publications, they slice it up into 3 or 4 tiny, less impactful papers. Reviewers are supposed to call that out.
Got it. Okay. Pillar 2, importance.
Does the study address a real gap in our knowledge? Does it matter? What's interesting here is that a study with very strong negative results, meaning they prove something doesn't work, can still be incredibly important.
Because it saves other people from going down that same dead end.
Precisely. Okay, pillar 3 is the big one, scientific rigor. This is all about integrity. Was the right patient group studied? Was the test compared to the right gold standard? If there's a flaw, the reviewer has to tell the editor if it's fixable or if it's a fatal flaw.
Makes sense.
Yeah.
Pillar 4, quality of writing and presentation.
Is it clear? Is it logical? Can a general radiologist understand it, not just a super subspecialist? And most importantly, do the results actually support the conclusions?
Pillar 5 is reader interest.
Yeah, radiology has a huge, broad audience, so if a paper is so niche that maybe 5 labs in the world will care, it's probably not a good fit for that journal.
And the final one, pillar 6, clinical impact. This feels like the bottom line.
It is. Will this research actually change how doctors practice medicine? Will it get adopted? A paper might address a cool theoretical question, but if it has no clear path to the clinic, it might be better for a more specialized journal.
That is such a clear framework. Okay, let's drill down into the nuts and bolts of rigor, especially in the core sections of the paper, starting with the methods.
The methods section is the recipe. You have to be able to follow it. So reviewers have to check for things like ethical committee approval, IRB oversight, and the inclusion and exclusion criteria for patients have to be crystal clear. If they're vague, the whole study is questionable.
And for imaging research, you need so much technical detail, right? Like software versions, vendors.
Oh, absolutely. Because a tiny change in a software version can completely alter the results. Without those details, no one can replicate the study, and if you can't replicate it, it's not really science.
Okay, let's talk stats. This is where a lot of us can get a little lost. What's the reviewer's main job here?
Their job is to check for clarity and sufficiency. First, the statistics have to be explained for a medical reader, not just for another statistician. Second, was the study big enough? Did they have enough patience? Ideally, you see a formal sample size calculation to justify it.
And what about for AI research? The standards there are even newer.
They are, and they're very specific. The authors have to spell out how to reproduce their work. The reviewer must check that the training, validation, and especially the test sets are all clearly defined. And then you have to really scrutinize that test set. If an AI looks perfect on a small, uniform group of patients, that tells you almost nothing about how it will work in the real world with diverse populations.
That's so critical for trusting AI in medicine. Okay, moving to the results section. What are reviewers looking for there?
Specificity. They want the numbers, not just a p-value of less than 0.05. They want confidence intervals, effect sizes. You need to know the degree of difference. How much better is this new thing, really?
And this is where that big red flag comes up, right? Data mining. Can you explain that?
Yeah, data mining is a huge problem. It's when authors don't have a clear hypothesis, so they just run hundreds of statistical tests on their data, hoping to find anything that's significant just by pure chance.
It's like throwing spaghetti at the wall and seeing what sticks.
Exactly. And you risk claiming a discovery that isn't real. It's called a type 1 error. When reviewers see that dozens and dozens of p-values, they'll immediately demand something like a Bonferroni correction, which is a statistical method that makes it much, much harder for those random chance findings to count as a real discovery.
So the reviewer is the defense against false claims.
They have to be. And then finally, in the discussion and conclusion, the reviewer's job is to make sure the conclusions are based only on the data presented. No overgeneralizing. And just as important, the limitations section has to be honest about the study's weaknesses.
This has been an incredible deep dive behind the curtain of science. We came in wanting to understand what makes research impactful, and we've wound up with a whole blueprint for scientific quality control.
And that's really the lesson, isn't it? Being well-informed isn't just knowing the facts from a study. It's understanding the rigorous system of checks and balances that decided those facts were reliable enough to share in the first place.
This whole framework, the demand for evidence, the need for transparency, the focus on impact, it's an incredibly powerful critical thinking tool.
And that's the thought I want to leave you with. We've talked about these rigorous standards for protecting medical practice. But what if you applied this exact same structure, the need for specific evidence, the careful consideration of novelty and impact, to the news articles, the business reports, the things you consume every single day? What new flaws or, what overlooked strengths might you suddenly discover? This isn't just a toolkit for science. It's a critical thinking toolkit for life.
The ultimate deep dive tool. Thank you for guiding us through that. And thank you all for joining us. We'll see you next time.